Welcome back. Acetaminophen has long been considered the safest pain reliever for expecting moms to use during pregnancy, but now a new study out links the popular drug to some pretty serious long-term side effects for a baby. Let's go ahead and bring in Dr. Masa Tarani, a board-certified rheumatologist. Doctor, tell us about the study and the results. And, I mean, it sounds like this is potentially transformational.
Yes, Jillian. So the group of researchers at Mount Sinai looked at over 46 studies, over 100,000 participants worldwide, and they found that in utero exposure to acetaminophen increases risk of autism as well as attention deficit hyperactivity type disorders. And the higher the dose, the longer the duration, increases this risk further. Now, we think this happens because acetaminophen can cross the placenta and it can interfere with the developing fetal brain with the chemical and hormonal signaling. And the big problem is acetaminophen, which is also known as brand names Tylenol, paracetamol, have been our go-to recommendations for pain and fever relief in these pregnant patients. I do have to say the study is not 100% cause and effect. It doesn't establish that, but it is a very strong observational study. And in this time where we're seeing such a significant rise in autism spectrum disorders, I don't think we should take this data lightly.
Wow. So a lot of people have said, oh, autism, it's vaccines. Would this maybe highlight another association?
I think it certainly gives another avenue for us to explore.
Are you going to tell your pregnant patients to not take acetaminophen based on the study?
That's a great question. I'm going to tell a lot of us reflexively, we have a minor ache, back pain, we reach for that medication. Right. I'm going to try to counsel them and say, if you have arthritis flares, try other things, heat, cold, physical therapy exercises. But if pregnant patients have fever, that's another story, because fever can itself cause issues with the pregnancy and malformations, and miscarriage risk goes up. So this is an area that the OBGYN has to get involved with and do lots of counseling with patients. Yeah,
risk-benefit analysis. There's something else we wanted to talk to you about, and it's some weird tick-borne illness that really seems to be prevalent on, of all places, Martha's Vineyard, where if you get bitten by this tick, you suddenly become allergic to meat and dairy. What is that all about?
Very weird.
Yes, it's very weird. It's called alpha-gal syndrome. It's actually an allergic reaction. So it's an allergic reaction to a sugar molecule in red meat and dairy, and us humans don't have this sugar molecule. So, and the Lone Star tick carries this sugar molecule in its saliva. So when it attaches to your skin and bites you, your body sees this sugar molecule, it mounts an antibody response, and the next time you have some steak or ice cream, the body sees that molecule and says, aha, this is bad, I'm going to attack it. And this, the whole reaction starts. What's really unusual, a lot of times it happens a few hours later after consuming a meal. So you have your dinner, 3 in the morning, patients are waking up feeling really hot, getting hives, having severe abdominal pain, and sometimes life-threatening anaphylactic reactions.
Oh my gosh, terrifying. You would not do well. Do not get bitten by a tick on Martha's Vineyard.
Can it be treated?
Well, the treatment is, of course, if somebody's having an anaphylactic reaction, epinephrine pens. But what's really important is prevention. These ticks, the reason this is rising, there are 450,000 cases in the U.S. right now.
Oh
it used to be in the southeast, but now it's traveling up to the northeast and Midwest states. So the best protection is for us to wear DEET-based tick sprays, permethrin-treated clothing, and to do full-body tick checks if you're outside and you come back in to remove those ticks right away.
Oh, wow.
Pretty terrifying.
That sounds awful.
I know.
Thank you for coming in to talk to us.
Great to see you.
Illuminating as always.
Thank you for the house call as always.
Thank you.
Appreciate it.
Hi, everyone. I'm Brian Kilmeade. I want you to do me a favor. I want you to click to subscribe to the Fox News YouTube page. This is the only way that I know for sure that you're not going to miss any great commentary, any great news bites, any great interviews coming your way on Fox. You can get it all here on YouTube. So subscribe right now.